Good evening. Well, if your newsroom is anything or your office is anything like our newsroom, you're probably seeing a lot of empty desks. Maybe you yourself are staying home sick with the flu, and we're using a lot of this hand sanitizer.
Look
here
at mine
First
up
Coast
close. So mine's almost all empty.
Empty. Yeah.
I'm really big on squirting this all the time. Oh gosh, there it goes. But the whole idea is to try not to be sick or get sick again. They're saying you could get this flu twice. That's kind of a scary thought. We've had a lot of folks battling it here. In fact, we were talking about, has anybody not gotten some kind of illness,
I know.
flu-related?
I'm one of the lucky few, but I've been using a lot of sanitizing wipes and a lot of hand sanitizer.
Juliette Dryer has been looking at the numbers right now, and it kind of makes you want to make sure that you don't do any of this or shake a lot of hands.
Yeah, Jeannie and Heather, for the third week in a row, flu activity in Florida increased sharply, according to the Florida Department of Health. And out of all of the children tested at Wolfson Children's Hospital this flu season, about 2/3 tested positive for the flu. In normal years, it's only about 1/3.
Coughing, sneezing, body aches. The flu's grip on Florida is only getting tighter.
This is probably one of the worst flu seasons we have seen in a long time.
In fact, Dr. Mobeen Rathor says it's one of the two worst flu seasons in the last 25 years, and it still might not have peaked. Wolfson Children's Hospital has seen a 10-fold increase in children showing up to the emergency department with the flu, from 42 at this point last year to 427 this year. And that's just at their downtown location.
The hospital is full. I mean, it's winter anyways. We get lots of infections, viral infections, but you're also seeing a good number of influenza cases that are being admitted.
In Florida, 5 children have died from the flu. All of them were unvaccinated, according to the Florida Department of Health. More than 50 children have died nationwide from the flu, according to the CDC. The CDC also reports the predominant flu strain is H3N2, which Dr. Rathor says is associated with more severe illness.
A lot of children and adults have died, but it can also cause severe pneumonia. It can cause patients who get influenza to be incapacitated. But usually it's the secondary bacterial infections that may occur once you have influenza infection that can cause some severe illness.
H3N2 isn't the only strain going around, which means, in theory, you could get the flu more than once.
It's possible that if they get flu A, then they can get flu B, but I can tell you that's extremely unlikely.
It's no doubt concerning to know the flu can have such serious, potentially deadly outcomes, but Dr. Rathor urges parents to consult a doctor first before taking their kids to the emergency room.
I think the most important thing is to contact your physician first, contact your pediatrician, and ask them, and they can advise you whether you should take the child to the hospital or not.
Dr. Rathor recommends getting the vaccine, even though it is less effective than years past. He says it can lessen symptoms if you do get the flu. He also urges people to stay home from work or school if they have flu-like symptoms. Be sure to wash your hands and also cough or sneeze into your elbow instead of into your hands. Juliette Dryer, First Coast News on your side.
Good.